I'm Julie Bartkey with this Senate update. Friday's Senate floor debate centered around the Health and Human Services Finance Bill. The $13 billion package did not include a provision Senator Barb Goodwin had fought for: grants to build mental health centers in different areas of the state. So she was the first to stand and try to get her provision amended into the larger bill.
This amendment is based off of a bill that I had this year. It is asking for grants for mental health crisis centers. We have a major issue in the state of Minnesota with the lack of psychiatric treatment beds and crisis centers. We have people that our jails are containing up to 70% of people with a mental illness because we don't have other resources for them, and they are ending up in jail for very minor crimes. Some people go through many times. What this amendment will do is to help those same folks, by when the police pick them up for disorderly conduct or disturbing the peace or something like that, they can drop them at one of these crisis centers, and they will from there be able to get a crisis bed if necessary, get outpatient treatment, be able to get a social worker or a mobile crisis team member or whatever to help follow them back into the community after their illness has been they've been de-escalated and they've been able to get additional help. They'll be able to get housing, Social Security disability if they need to, get on Medicaid, to get prescription coverage or other things that are similar to that. Now, this bill passed judiciary unanimously. This is not a partisan issue at all. And it also passed Health and Human Service Finance for possible inclusion in the bill with only one no vote. I think a lot of us have heard from our sheriffs and our police and our courts, our county attorneys, about their concern about this issue and about they are not equipped to deal with people with mental illness. The cost to the system in the state of Minnesota is tremendous. We are either bringing people that don't belong in emergency rooms to emergency rooms where they can sit for days and wait for them to find a residential treatment bed for them. We've got, or at least the chair's got, and I received a petition from Allina Health Systems that emergency room personnel have put in their comments about what the mental health system is like and what they're dealing with in the emergency rooms. And they are saying things I've got a whole set of things that they said about this, and I didn't promote this in any way. I just got the petition a few weeks ago, but they are very concerned about the lack of services for people with mental illness. We are basically treating people with mental illness like they are criminals in this state. We are not providing services for them, and it is ethically and morally and even religiously wrong. If somebody acted up that had Alzheimer's, or if they got aggressive, which they do, we would never even think of putting them in jail. If somebody got in a car accident and had a brain injury and got very aggressive, which they do, we would not even think about putting them in jail. Somebody had a brain tumor and got aggressive, we would not even think of putting them in jail. But we do this with people with mental illness because we have not provided the services in the state of Minnesota. We have, of all the 50 states, Minnesota has the least number of psychiatric treatment beds of all the states in the nation. That is a very sad statement about what we're doing in this area, or I should say not doing. There was an article in the Star and Tribune, editorial actually, a while back, and here's what they said about this, the editorial board. Despite a deep decline in crime, admissions to local jails have nearly doubled over the past 30 years. Attempting to explain the paradox, a new report from the Vera Institute of Justice concludes that jails are grossly misused. They were originally meant to be for people that were deemed too dangerous to release pending trial, or those who are likely to flee before a trial can begin, but that no longer describes what jails do or who is in jail. 60% of these folks with mental illness are too poor to pay even the minimum bail required for minor crimes, so they stay in longer, which are often things like traffic, drug, property, or public order defenses. Medicaid does not cover people in jail, so if they're on medications and they need to get those medications, the county jail has to cover those, and we're not funding them for that. And it says also in this editorial that people with mental disorders, for them, jail becomes a kind of revolving door lifestyle. The emerging picture, this is a sad thing, but the emerging picture is one of the local jails becoming modern-day debtors' prisons and places to stash the mentally ill. It says that after the deinstitutionalization, a large segment has simply been dumped on the sidewalks of major cities, including Minneapolis and St. Paul, and most of those divide their time between jail and the street with far too little attention to their mental health. And then they talk about my bill, and they say that too often it's back on the street with a sheet of paper suggesting where they might go to get help. But that doesn't work with this particular population. What's needed is an option for police to take unruly and troubled people to psychiatric crisis centers rather than to jail. There are 500 such diversion programs across the country, but none in Minnesota. And Minnesota is near the bottom, and actually we're at the bottom, I found out, as far as per capita supply of psychiatric beds. In the governor's budget, he proposed 3 new residential treatment centers, which would be 16-bed centers. None of those are funded in this Health and Human Service bill. Now, I understand how funding can be stretched around here and how it can be difficult to get all the things done we need to do. But this is an area that we've not only paid enough attention to, but it's an area that we've cut several times when we needed to have budget dollars. And as Senator Laurie said, there's $36 million in this budget for mental health. And some of the things we're already doing are good things. Mobile crisis teams are good things. Police crisis intervention training is a very good thing. And I wish all the police in the state could be trained in that, because it would help them learn how to de-escalate a situation. But a mobile crisis team member can go to your home and help you out if you are in a psychiatric state, if you're majorly depressed and contemplating suicide, but all they can do is stay with you for a few hours. And if you're all familiar with paranoid schizophrenia and other severe and persistent mental illnesses, a few hours is not enough if you're having a psychotic breakdown. The only people that have fought this bill are a few of the vendors, providers, and a very few of them by that too, because I was told that the Minnesota Mental Health Legislative Network opposed this bill, but we've been calling all the people that belong to that group, and a number of them have said that they have no stance on this at all, or that they support it and wanted to know what they could do to help. Several people were misled on what this bill actually does, and even told on one website for NAMI that all it is for a one-night stay, and then that's all that happens to them. That's exactly the opposite of what this bill does. This bill is coordinating, collaborating services for serious and persistent mental illness, so that social services and corrections are working together with the nonprofits and the for-profit providers in the community, the mobile crisis teams, and those police officers trained with mental health crisis training. I have traveled the state in the last 2 years, and I guess somebody said this, Senator Laurie said this bill wasn't ready for prime time, and I just want to have you take a look at my desk, because everything on here is my last 2 years of work on this issue. This book alone, if I can handle it, goes through all the studies that have been done in the nation, and it goes through all of the editorials and media that has been done on this issue. So we all should be aware of this. I wasn't aware of it until 2 years ago when the Star and Tribune series came out on the problem, and then people started talking about it all over the state. And now those people, those media outlets that have done stories on this, and extensive stories, include the Star and Tribune, the Pioneer Press, the International Falls Journal, the Beltrami paper, Wilmer Radio, all 4 of our major TV stations here in the metro area. Duluth Channel 3 did a whole week on the issue. The International Falls paper did 3 days on the issue of jail diversion and the need for it. The Star and Tribune did a whole series, and they've done several other articles since then. I want to tell you about a few people that have called me since they knew I was doing this, that don't live in my district and don't know me, and I didn't know them. One woman from Alexandria wrote me a letter, and she wrote it to Senator Ingebrigtsen as well. In February, her husband had a psychotic breakdown. He has bipolar disease, paranoid schizophrenia, major depressive disorder, PTSD, and anxiety. Their 18-year-old son called the police because he was having a very, very difficult psychotic breakdown. And he said, my father needs to be taken to the hospital. He needs treatment again. The police came, picked him up, put him in jail. They promised the woman, the wife, that they would put him in the hospital. They put him in jail. He sat there for 5 days, 2 of those days in solitary confinement. His medication was very detailed. He'd been going through for many years with a psychiatrist and trying to get his medications right to deal with all these issues, because it can take time. He didn't get those medications while he was in jail. 5 days later, he was in such a horrible, sad state that when she finally got him out of jail, after begging everybody to bring him to the hospital like they promised, he was in very dire straits. He was worse off than he was before. This happens all the time. This is not a single case. She called me Sunday night at home. I don't know how she got my home number, but she called me at home, and she said, my husband has now got to go to court for what happened to him when he was supposed to go to the hospital in the first place. And he's beside himself. When you have issues like paranoid schizophrenia, everybody's out to get you. And when you get thrown in jail, you're sure that's true. Everybody is out to get you. So I said, what's the charge? She said, disorderly conduct. Disorderly conduct. And he can't go. He can't go. If he goes, this is going to be a horrible situation. So she's going in his place, and I said, I'm not a lawyer. I don't know what to tell you about that, except that you should bring all of his medical records and talk to the judge about it. I had a judge call me from Beltrami County in the summer. She said, we have a man that we picked up that wandered into somebody's garage, so we picked him up for trespassing, and he was talking nonsense. And we didn't have any place to put him, so we put him in jail. He was there for 4 days. At the end of that 4 days, he started his bed on fire. Now he's going to be charged with a felony, and he does not belong in prison, she said. And yet I'm going to have to sit in judgment on him on a felony offense. He should have been in treatment. But places like Beltrami County and other places in a lot of your districts, here's what happens. The police pick him up, they have nowhere to bring him. If they do have an emergency room, they bring him there, and the officer sits with the person for 2 to 24 hours because they have to stay with them until they get help. The emergency room either says, you don't reach the hospital level of care, or you need to go into residential treatment. The hospital tries to get residential treatment for them, but they can't because there isn't any beds open. Another woman from Eden Prairie called me a couple weeks ago, and she said my daughter is in Mankato at the college there. She was suicidal last week. She said I brought her down to Mayo Clinic. Her roommates called me and said she's suicidal. She's got anxiety, severe anxiety. I brought her down to Mayo Clinic, emergency room. They treated her and they said she needs residential treatment center. She needs to have a treatment bed. The mother looked all over the state for a treatment bed for 2-3 days while her daughter was suicidal. She finally was told she might have to go to North Dakota or South Dakota or Wisconsin. Eventually, she did find an open bed that came open in Brainerd, and she brought her up there. But the daughter wanted her mother with her, and the mother worked in Eden Prairie. This is just a few of the cases that I've heard over the last 2 years. And I've studied this issue more than I've ever studied any issue. And I can tell you that your county attorneys, your police chiefs and your police, your courts, your judges, your county attorneys, your defense attorneys, your prosecutors, they're all going to tell you the same thing. We need help. We need these services. And the only people that have been fighting it are the people that should be supporting it. And it's sad, and I can't even understand why they do that, because they've had to struggle for dollars for mental health forever. And they're afraid that anything else new that might come up is going to take money away from them. I even traveled to Orange County, Florida. They have a facility there that's been open for 11 years, a crisis center. While I was there, at least 5 squad cars pulled up at different times during the time I was there. They had people in handcuffs, and they brought them into the crisis center and took the handcuffs off, and the crisis center took care of them from there. They had a psychiatric and a medical evaluation. They went into a crisis bed for anywhere from 1 to 5 days. If they needed extended treatment, they had extended treatment beds for up to 3 weeks. In all the time they'd been open, they only had to put 2 people in their state hospital. They were able to manage them in the crisis center. 30% of those people were chronically homeless. They had a homeless center for them. In the homeless center, they were allowed to stay there for 1 to 2 years or more if they needed it, and their chemical dependency was treated and their mental illness. And then they were able to, by the time they got through there, they had job skills, they had support, they were off the chemicals, they were able to get apartments of their own. But you know what happens to people with mental illness when they've been jailed? They can't get housing. They got a record. So now they're not only sick, but they're sick with a police record. Folks, I'm telling you, this, I think of anything I've ever worked in my 30 years on and off at the legislature in very different capacities, nothing has been this important to me. Nothing. And I have nothing to gain from it. Nothing at all. But I'm telling you, this is a need in every single county in Minnesota. And all this bill is going to do is start the process for finding alternatives by developing a couple of crisis centers in the state to be able to help keep people out of jail where they don't belong, and to save millions of dollars along the way. I've got the reports from Orange County, Florida, from San Antonio, Texas, from King County, Washington, all the places that have these or are developing these in the nation. And everyone that's been developed for any length of time is bragging about what a wonderful job this is. And the police and the sheriffs and the attorneys and everybody's supporting it. And you know what? In those states, I talked to the directors of NAMI, and NAMI was the outfit that was pushing it in the first place. I talked to the directors of NAMI in Florida, the former director and the current director, and it's so successful down there that they're starting 2 more, one in Miami-Dade and one in Quinton County, I think they said, something like that. But they're starting 2 more because it's so successful at keeping people out of jail, at saving money, and at helping people get housing. So I will stand for, the money in this bill, $3 million, is coming out of a $14 million appropriation for IT, mostly for IT. So nobody else's programs are getting cut by what I'm proposing here. And it's only taking $3 million out of $14 million. So I hope we can support this, members. It's not a partisan issue. It's something all of our counties understand and know about, and all the families of people with mental illness really want.
And I want to sincerely thank Senator Goodwin for her passionate advocacy for people who need to be served better than they are today. I recognize that she's worked on this for a very long time. And in recognition of that, we did, as I walked through the proposals in this bill, we did fund the Beltrami County pilot project to do just this type in one area of the state. I know that Senator Goodwin would like to see much more, but honestly, as I worked on trying to figure out how to approach the mental health crisis that we have in the state of Minnesota and the need to invest in services that are proven and that can work to help people, the package that we have in here, I think, is really well balanced and will help people live successfully in our communities. We do have investments to increase the capacity in our current behavioral health hospitals, the CBHHs. We do have the Children's Psychiatric Residential Treatment Facilities, 150 beds there, the 30 new extended stay contract children's beds, and we also have a significant investment stabilizing our current mental health bed capacity. Currently there's 33 IRTs already, the 16 bed facilities that you discussed, and 13 standalone residential providers around the state that are, as I mentioned, fragile in their financing right now. And we have grants to ensure their continued viability and study to make sure that we have an ongoing payment system that can meet their needs to continue to fulfill this really critical need. We also have significant investments to help people stay healthy in the community. I'll just talk about one of them briefly. The 5 new ACT teams that are going to be 4 in greater Minnesota, 1 in the metro. This is 500 people who are going to be served by an ACT team. And this is proven evidence-based strategy for helping people maintain their health in the community. It's demonstrated clearly. There's a 60% reduction in hospitalizations in the first year of access to this critical service that we're investing significant dollars into. That relieves the burden on the inpatient side. You know, and Senator Goodwin, I think that a pilot study is a pilot project is a good use of funds. I will commit to you that I will pay close attention and work with you to see how that works and see what learnings we can have from there and move forward to take whatever learnings we have and continue to reform the system to do better. This A37 amendment has a couple of issues with it that are going to lead me to reluctantly ask members to oppose the A37 amendment. First off, the manner in which the amendment takes from the existing information technology investments that are embedded in this bill would mean that many of the other aspects of this bill that require an IT upgrade in order to make happen would put the rest of the bill really at significant risk for being able to be implemented. We can't take away the information technology investment that is needed to deliver on all of these other programs and worthy programs in the bill. So from that perspective alone, it is troubling. And then the other issue that I have with the bill that again makes me reluctantly oppose it is it's a wonderful vision that Senator Goodwin brings forward, but it's not able to be accomplished with $3 million of one-time funding. There are significant requirements of the counties that would be the lead agency in applying for one of these grants. And I asked on the record when this was heard in our division, do you have, Senator Goodwin, any county commissioners, any county boards that have stepped forward and said, yes, we will take on the ongoing costs of operating something like this? And I have yet to hear from them. I do understand that sheriffs and law enforcement are very passionate. I've had many of them, and that they are the boots on the ground that struggle with this. And I've talked with them at length about the need to continue to look at ways to address this, but trying to say that a $3 million one-time investment is going to build the system that we need is a bit ahead of what we're able to accomplish in this budget. So with the Beltrami County pilot, which they seem very ready to go on that pilot. We did put that in the bill and really look forward to seeing the results that we get from that. But destabilizing the rest of the bill and our ability to deliver on it by taking the money from the necessary IT components of delivering on the rest of the proposals and the fact that it's a $3 million one-time investment would lead me to ask members to oppose the A37 amendment at this time.
My first wife's two brothers were schizophrenic, and one, because of his situation out in Washington, D.C., is deceased. And I have another brother-in-law that I can't find. He basically has gotten help here in Minnesota for about 5 days, and then he fled because of his disease and the fact that he could not handle being kept and get the help that he needed. I sometimes get a cell phone number, phone call, and he leaves a message on my phone saying, "Happy Easter, Merry Christmas, Happy Thanksgiving." And when I try to find out where the cell phone number is, it's in Washington State. And I know when I call the number back, it's not his cell phone number. So I know what mental illness is, and because it's struck my family on my wife's side, and I know how damaging it is to not only for my first wife and her desire to meet the needs of her brothers, but it also hurts. It also hurts sons and daughters and nieces and nephews who are related to these individuals. And when brothers-in-laws, or maybe it's a brother or a son or a individual from your family who gets put in jail, as Senator Goodwin's mentioned, and because it happened in my family, and you get a phone call from a police chief in Southern California, or in 30 days you get a call from the police chief in Albuquerque, New Mexico, and they want to verify if this person is who he says he is. You understand that when they can't get help and there's no beds for these individuals, that we really have a major problem. And to hear, as Senator Goodwin's mentioned, that Minnesota's at the bottom in regards to helping and reaching out to these individuals. As much as we've said today on the floor, we've got lots of good programs. We've got a great list of people who are endorsing these individuals, and yet we've not stepped up to take and make this thing happen. As was mentioned from Senator Goodwin, the facility that's happening down in Florida, and the fact that they're expanding their facility to add 2 more facilities to meet the needs. And when you get the cry of your Wright County Sheriff coming to your offices, and you get the chief police calling you up on just after Thanksgiving, and the administrator from the Buffalo Hospital wanting you to sit down and just before Christmas and saying, "We have a crisis. We have a major crisis in Wright County." Well, it's not just in Wright County. It's in the state of Minnesota. It's in the state. It's in the United States of America. We have a major, major crisis, and we need to deal with it. And we need to get these people help. They don't need to end up in our jails. They don't need to have a name tag and a picture of themselves showing up to say they are a criminal. Because when you get their help and you get the right medications and you get them on the right path, they're very useful, they're very successful citizens. Because I know when my brother-in-law got his medications right and we helped him out and he was able to stay, he stayed in Minnesota for 3 years. But all of a sudden the mind clicks, something happens. These people are so susceptible to impressions from other people. He was staying in a hotel in Buffalo. They call it the Buffalo Hotel. And all of a sudden, because of the new law that we put in place, he could no longer smoke in his room in the Buffalo Hotel. He had to go outside. Well, anybody with a mental health issue, if they're addicted to any type of a substance abuse, they all of a sudden, it clicks in the mind and they're off. And no matter what you've tried to do to calm them, to straighten them out, it seems like they have got one thing set in their mind and they go in the opposite direction of where you would like them to go. So they need help. They need our compassion to deal with each individual. And it's not just my family. There's many other families, and maybe many here on the floor can speak to those too. So I really support Senator Goodwin's effort to come forward to ask that, and as you already mentioned, Senator Laurie, $3 million is not enough. And I don't think Senator Goodwin started out with that figure, but I think just to help out and trying to get to some place bigger and larger, because as we've already talked about it here in Florida, they see the crisis situation. They're building 2 more crisis areas to help out these individuals. And we're just basically at the tip of the iceberg. So, members, I appreciate the opportunity to speak, and I appreciate your willingness to support Senator Goodwin in her efforts to help those people, law enforcement, social services here in the state of Minnesota, our health system here in our counties, because when you have to go as the chief of police in Buffalo had to go all the way to Fargo, North Dakota to find a bed for one of his people who had sat in his local jail for 3 days because they couldn't find someplace. And yet, I was just told that we could go to these people here in the Twin Cities and we'd find beds. I guess not. We have to go to South Dakota, North Dakota, someplace else to get help for our people.
There are times you stand up and simply search for the words, and that is me today. I'm not sure how I'm going to articulate my feelings, but know that they're deep and they're profound, and I would simply urge all of you to think long and hard about this amendment, because I think it's an important one. It's probably, I don't know where this session's going. I don't know that I could speak from a heart, at least, a more personally compelling amendment this entire session. And I say that, and I think maybe to some extent many of us in the room, we maybe don't talk about it a lot, but we've all maybe been touched in one way or another by mental illness. I grew up with it, both parents. Wasn't fun. Long time ago, wasn't much treatment, you know, and it was tough. But as I think about this issue, and I think about, and let me just say, Senator Laurie, you're a kind, compassionate person. I know you are. Your mother was, you are. It's just, that's the Laurie family. And I know that your objection to this is not out of anything other than you're concerned about your budget and numbers and all of that, but I would just say that I think this one goes way beyond budgets and numbers, and it's all people. And I think, Senator Laurie, you know about that too. You're a people person through and through. And so I would just urge you to kind of think, you know, if you can ever bend on something and say, you know what, maybe we ought to just try this. Maybe we can make it work. I think this is the time. I can think of no more profoundly awful situation, because to some extent I experienced myself as a little 12-year-old kid. And yeah, neither mom or dad went to jail or anything like that, but I can imagine if the journey into someone's mental illness diagnosis starts in the back of a police car and then moves into a jail, maybe a mugshot, all of that. I cannot imagine there is a worse way to enter into that mental health diagnosis and treatment than going through that sort of an episode. And as we talk to our sheriffs and our police chiefs, all of us, and we know this, doesn't matter what county you live in, as is pointed out in the documents we have, so many of these people really don't belong in jail because of a criminal sort of issue. They're mentally ill. It's a disease. It's a disease. We didn't always think about it as a disease. You know, as growing up, you know, I hate to say it, some people in my little community thought my parents were crazy. That's what we called it. It was awful, you know. But, you know, you grow up and you grow through those things. But this is real. And I just hope that we can find a way that when this comes up to a vote today, that we just don't vote Democrats and Republicans. We just vote from our heart and vote for what is right. And somehow, I think if we do this amendment, it's going to work out. And it's going to work out in every county across Minnesota for the good of people that, unfortunately, as the case might be, are mentally ill, that find their way into our criminal correction system. It's the wrong route, but at least if it is a route, let's make that journey into that system the right kind of a journey. These mental health crisis centers are the place for these people to go to. That is the right way to handle these people. That is the right way to move them through their, if you will, their diagnosis on into a treatment, and as Senator Anderson has pointed out, into a successful life. This is just so important, members. Give it a long, hard thought. And Senator Laurie, I just urge you to kind of, I know you say I'm reluctant, I really like to do that. Kind of lift your reluctance on this one and let it go. Let's give these things a chance. I think Senator Goodman's got an amendment here that we ought to try to all support and get behind. It's just that important.
You know, this is a really heartfelt issue, and I have more personal stories than I care to relate in dealing with people with mental illness, and I take it incredibly serious as well. And I agree with Senator Senjum that starting your involvement with the mental health system in the back of a police car is absolutely devastating, and having it go to the jail is insult on injury. I get that, and I've met with people in jail. I've met with people before their jail sentence. I've sat down with people struggling with mental illness, and by and large, I mean, you know, psychotic events will occur, and there will be interactions with the police. But many, many, many of the folks who wind up in the back of those police cars, if we'd been able to get them the help they needed 2 weeks earlier, a month earlier, a year earlier, and built the stable community-based network to keep them from that, it will work. And it really will. I worked with one guy that I'll never forget. I mean, I sat with him for hours and tried to find him some community-based supports, and those didn't exist either. I couldn't get him hooked up to the community supports that he needed to stay healthy. And 2 weeks later, he did wind up in jail. Both sides of that equation were wrong. And we do have the investment in our existing CBHHs to provide additional bed capacity. We also have the 180 new beds for children and adolescents that'll help relieve some of the pressure. We have the community-based tools. And I'm not going to say that there isn't a greater need for beds. There is. And that's something I believe is a growth area that we can work on in conference committee. And I will commit to working on that in conference committee. What I had before me was a proposal from the department to build 3 new state-operated services, another 133 FTEs for the Department of Human Services to staff these. And year after year, we pour more FTEs into state-operated services, and that hasn't worked either. We just funded 85, I think, new FTEs in the deficiency bill, and I've continued to support people in St. Peter and our security hospital, and in this bill we've carried that set of FTEs forward as well, and we've put the FTEs in to build the capacity to be able to fill our CBHHs as they exist now across the state, and Bemidji, Baxter, and St. Peter. And make that significant investment to try to keep people out of the backseat of the police car in the first place. Now, I wasn't really ready to embrace that 3 new 16-bed facility with all those FTEs at DHS because, again, we've had serious problems with that. And I didn't have another proposal in front of me at the time. I think we should all get a little bit more creative. This one with the one-time funding and the manner in which it would roll through the rest of the good proposals in here and undercut the IT development that's critical for the rest of these proposals' success just really makes me ask members to oppose this A37 amendment. And I, again, need to state how much I appreciate Senator Goodwin's hard work and sincere passion on this important issue.
When I went to the Police and Sheriff's Association meeting a couple of weeks ago, I asked one question very first before I said a thing, and that is, how many of you have had to bring people with mental illness to jail that didn't belong there because you didn't have other options? And every single one of them raised their hands. Every single one in that room raised their hands. That's a problem. That's a problem. And I understand Senator Lori's issue about prevention is better, and if we get all these things going, we can stop this. This is a crisis. Somebody's in a crisis. You can't stop a crisis any more than you can stop a car accident if it's bound to happen. And that's what we're saying, that's what we're building our mental health system on right now. The fact that somehow we can stop somebody from paranoid schizophrenia, from acting out, and in trying to hurt others or hurt themselves when it's really just their illness. That's creating that problem at the time. We're going in the right direction, a lot of things, and Senator Lori's trying to do. But what they can't get through their heads is that none of that is going to prevent people from going into a mental health crisis. It's like saying, let's close all the hospitals down or all the cancer units and treat everybody at home. Or let's take the Alzheimer's people out of the memory care centers when they get aggressive and just leave them at home. This is the same thing. That's what we're saying. It's going to work. It doesn't work. No matter how much we live in Candyland, you get tired of eating the same thing. And when it's not working, you got to get something more substantial. And we're not going to be able to prevent crisis, no matter how many times we train police officers, no matter how much we put mobile help or ACT teams together. We are not going to be able to prevent people from having a crisis that can last days or weeks or months. So folks, we got to turn in a little different direction here. We've got to try something. And I want to tell you something else. We got nonprofits and profits in the state, vendors that are doing a good job and working hard. But you want somebody gets aggressive in there. That means somebody spits, or somebody starts stomping their feet around or acts threatening towards another patient. The police get called, and then they go to jail. Well, that's why this is county, because county won't be able to turn people down. So that some people just can't get help at all because they act out some aggressiveness. And that is not appropriate. If you had a brain injury, you'd be aggressive. They wouldn't put you in jail. If you had Alzheimer's, they wouldn't put you in jail. So folks, please, let's try something new. That's all I'm asking. It's not a lot of money, and it's out of the IT budget, which is $14 million. It only takes $3 million from that. Last night in finance, we heard from the Department of Education that is spending $16 million a year for tests that aren't working out and are causing problems for students. If we could cross these silos and take the money from other places, it would be easy to do, but we can't. So I'm taking it out of these IT services, and I can tell you, I used to study contracts in IT services, and some of those are so overblown, and we're paying way too much money, more than we need to be paying. And I think they can get along with $3 million less out of a $14 million budget.